Let's talk about a case scenario today. I had a gentleman, 54-year-old male, who came to my office with just nagging low back pain, minimal leg pain whatsoever. Back pain is what killed him. He presented after years of conservative care, physical therapy, medial branch blocks, chiropractic therapies, acupunctures, whatever blue emu he can find over the shelves over at CVS, Walgreens, whatever you may want to call it. So every rub there was, he tried it, he was just at his wit's end. Now this isn't someone who's out of shape or whatsoever. This is someone who is an avid golfer, someone who is a foreman at a major construction company here in town, very wildly successful guy who was looking for just an alternative to the fusion. So he's well versed on the literature out there, did a lot of Googling and chat GPTing and everything else like that, and came to us just to have a regular conversation, right? So we sit down, his wife and I, and we talked about the different options. And at that point, I wanted to identify the pain generator, making sure that, hey, is this not related to the facet joints, or is it disc-mediated back pain? Had him go through the same ringer that I always tell my patients to go through. Look, I can always do surgery just based on the MRI, but let me go ahead and sleep better at night so that I can go ahead and be, reasonably confident that I've identified the pain generator and we're doing surgery for the right reason. He had an amazing block of his disc where my colleague put a needle right into the disc, put a little bit of a long-acting anesthetic. Patient had the best relief of his life, but it was short-lived. At that point, we were like, booyah, right? We've nailed the diagnosis, fingers crossed. This is what I would recommend. I do have some reservations. He had nice tall discs at every other level except for L5-S1, the MRI markers showing the different changes at the vertebrae, all pointing to it, and of course the positive diagnostic block, all added to the same thing, that the disc was the correct diagnosis. But he was so collapsed, his disc height was only 2 millimeters, and my reservation was, hey, we may either break the vertebrae trying to get a artificial disc replacement, or we're just not going to be able to loosen his spine from the years of degradation and have to resort back to a fusion. So he's like, Doc, I trust you, and let's pull the trigger. We did his surgery several months ago where he had an artificial disc replacement. And just so that everybody understands, these things are being done in an outpatient facility now, don't need any prolonged hospital stays. Underwent the surgery without a hiccup, post-operatively, called him that evening just to make sure things are on the up and up. And the patient is like, I can automatically feel that my back doesn't ache the way it does when I would sit up or when I would cough. Now, of course, he had some abdominal pain from the surgical incision, and of course, that's discomforting. So I checked back with him like I usually do the next morning. How you doing? He'd already walked a quarter mile, something that he hadn't been able to do in years. The wife was also on the phone going, I haven't seen him with the disposition, the enlightenment on his face, going, hey, the surgical cut's gonna heal, on its own terms, but my God, I feel so much better. So that being said, let me go ahead and show you what the x-rays look like and what we did for him in my exam room. So here we are in my exam room where we always use the big screen monitor to educate our patients. So this is a 54-year-old gentleman that was an avid golfer, wildly successful gentleman who wanted his life back. On the left side of the screen is a preoperative image. This is L5-S1, the very foundation of your lumbar spine, right? You can see how collapsed his disc space is, and we measured this out to be about 2 millimeters at its highest point on the disc. It's bone on bone in the back here. And there's some subtle changes, irregular changes that you can see from the advanced years of degeneration, subchondral cysts, they call modic changes. It's medical stuff that I don't want to bore you about, but essentially an advancedly degenerative level that was diagnosed as being his pain generator. So once we got the appropriate diagnosis, again, we could either go ahead and put a cage in there and fire some screws across, or what we chose to do was what we see on the right side of the screen. Now, this isn't as focused view, but I wanted you to go ahead and get the entire understanding of the lumbar spine. And I've said this in our other videos, L5-S1 is probably one of the key levels that you want to nail down perfectly the first time. And you can see how the changes, once you fix L5-S1, whether with the fusion or a disc replacement, notice how L4-5 isn't angling downward like it is at the preoperative level, right? So we were able to do an artificial disc replacement on him successfully with complete relief of his back pain and back to doing all the recreational activities as well as activities of daily living in a pain-free manner. Happy customer, happy patient, living life the way he should. So now that we've seen what we did for this other gentleman in his mid-50s, give us a call to see if you fall into the same group and see what we can do for you. Whether it's an artificial disc replacement or an endoscopic decompression, we got you.